Hello and welcome to the EduTalk series hosted by Biotone Edu Partner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Fred Stahlman, who began his career in health, wellness, and manual therapies in the 1970s. He's a physical therapist and certified instructor with Upledger Institute and AHI, the International Association of Healthcare Educators. He is skilled in bridging traditional and complementary approaches to improve client outcomes with the understanding of their particular issues. Let's listen and learn how craniosacral therapy benefits PTSD clients as Fred discusses the light touch of craniosacral therapy in balancing the autonomic nervous system to reduce adverse mechanical tension of physical symptoms experienced by PTSD clients. Fred explains how combining craniosacral therapy with SomatoEmotional Release, Fred, correct me if I'm wrong on that, and assists PTSD clients to unlock emotional traumas held in the body to facilitate healing outcomes. And with that, I welcome you, Fred. Thank you for joining us. I know we have a lot to cover. I am going to turn the screen over to you, and I'll see you on the other side. And everyone, thank you for joining us tonight. Please be sure your sound is muted and video off, as well as feel free to chat questions that Fred will answer at the end. All right, Fred, we'll see you on the other side. Thanks so much.
Thank you very much for your kind words. It's an honor for me to be here with you tonight. I'm excited about craniosacral therapy. Certainly it has been, my lifeblood since I met John Upledger in 1986. So my background is purely manual therapy. It has always been that, coming out of Northwestern with my PT degree, where my primary instructor was Dorothy Voss, who taught the whole concept of proprioceptive neuromuscular facilitation, or PNF. And so I moved into the manual therapy field right after that, studying with every major instructor in the physical therapy world, since they didn't mix disciplines at that time. And I loved the work and I got quite proficient at it, but there was still something missing from my overall application, because I still felt like I was treating superficially and treating symptoms and not source. So a friend of mine introduced me to the concept of John Upledger, Dr. John Upledger, who was just beginning to teach his craniosacral classes. And this was in January of 1986. So once I read the brochure and looked at what Dr. Upledger was teaching, I jumped on the plane and took the very first class in January of 1986, and I haven't looked back yet. The work has met a need that I was searching for, and that's to help people be empowered. I wanted a discipline that didn't necessarily treat symptoms, but treated the source of the problem. And it was all designed at helping empower the patient to be in charge of their own healing process. And I found that for me, craniosacral therapy has done that. So Danielle, if you want to pop up the PowerPoint and you can help me with that, it would be great. So just for references, this is where you can contact me. This is my name and obviously connection information. It's my email address as well as my personal cell phone number. If you have questions, I don't mind returning calls. I don't answer my phone very well, but I do return calls well, and I do text and email. So this is where I hang out. I live in Palm Beach Gardens, Florida, and I work at the Institute 5 days a week, which is where I'm doing this little broadcast right now. It's from my office. So that's where I'm coming from, and we're really excited. It's okay. Moving on is perfect. Thank you. So as we're looking at one of the biggest challenges we always have in this work that we do when we're working with light touch work, which always has an energetic perspective, is how do you define it? It's a very subjective experience work, but it is a system that is universal. It's composed of the tissues, fluids, and the core of the body. It's made up of the brain and spinal cord, the lining of the brain and spinal cord, the duromater, and it's a cerebral spinal fluid that is the source of the rhythm that we're palpating. So, and it's basically the production, circulation, and reabsorption of the cerebral spinal fluid driven by inherent rhythms within the nervous system that creates a rhythm pattern that we can monitor, palpate, and we're looking for symmetry and quality, amplitude, and rate. So you can move to the next one, thank you. And just continuing here with the whole craniosacral system functioned in close relation to all the other systems in the body. You know, it's a system that doesn't get nearly the attention as the respiratory system, the cardiac, the vascular system, the neurological system, of course, but it is to the overall function of the brain and spinal cord. Without that, you would not be functioning well at all, if at all. And this whole work began with the development of the whole osteopathic movement, which was done by a fellow named A.T. Still back in the 1860s. And he was a medical student who really got frustrated with the lack of results, the trial and error nature of treating patients with medicinals, sometimes mostly very toxic, like mercury was a major treatment for meningitis back in those days. So he started his own school at Kirksville College of Osteopathy. One of the major players that came out of that school, William Sutherland, had the ability to perceive cranial bones motion patterns, when he called it the craniorhythmic impulse, the primary respiratory mechanism. So he's the one that first discovered the fact that this rhythm existed. Then he went on to try to map it out and describe it. And there's still a teaching academy with his name on it in most osteopathic schools. And he got his influence from Dr. Still and this Emanuel Swedenborg, who was a Renaissance scientist in Europe studying the brain and soul connection. And basically the four principles of the craniosacral work is the body is a unified whole. You cannot treat just a part without having influence everywhere else. And secondly, structure and function are interrelated, so that if you have a change in structure, the function will adapt in time, as well if there's a change in function, the structure adapts. And the other major aspect was there was a unifying healing, which Dr. Still back in the 1800s called a higher power. Dr. Upledger and most of the osteopathic profession will call that an inner wisdom or an inner guide. But it is what really drives the healing process. Now, also let's look at this definition of post-traumatic stress disorder. This is a disorder that was named simply because of a collection of symptoms and coming out of mainly war front. It used to be called battle fatigue, but after the Vietnam War, they started looking at the whole issue of post-traumatic stress disorder and the problems associated with that, and obviously gave it a name. And it's really a mental health issue that is triggered by the terrifying event, either experiencing it or witnessing it. Now, we often associate that with veterans and war and fighting, but it can be any type of trauma pattern, a severe car accident, someone who's in an abusive relationship. Obviously, trauma, witnessing a trauma, not even being in it, but seeing it, creates a problem in our nervous system that it anchors, and it tends to come back and repeat the presentation under certain circumstances. Avoidance, negative change in thinking and mood, and certainly changes in physical and emotional reactions. And if you're familiar with PTSD, very common for a veteran suffering from this type of a trauma pattern, is attending a 4th of July parade and hears firecrackers going off and will be triggered right back into the experience because the body holds on to the trauma pattern and the emotional hook is the driver. So sometimes common memories that come back, sounds, smells, tastes, things that you hear, can trigger an adverse reaction and activate the PTSD symptom presentation. So you can go, there you go, thank you. So when we're doing craniosacral therapy, I think the biggest influence that craniosacral therapy has on any diagnosis or any symptom presentation is it really tends to turn down the sympathetic autonomic nervous system, or SANS, as we often abbreviate it, because whenever the body is under stress, I think a lot of us have been reading a lot about, hearing a lot about this polyvagal theory that's out there to try to explain the stress response. And part of that stress response is activation of the sympathetic nervous system and what they call the dorsal vagal system. So when we talk about stress response, we usually talk about fight or flight, but we don't always think about the freeze part. And the freeze is a huge piece of defensive tactic employed by all animals. I think we've all seen that watching videos of animals being chased by a predator. And sometimes they get cornered and they just freeze. They're not dead, but they just stop down, hoping that the predator won't want a dead prey and they'll move on. It's a very effective, very ancient defense system operated by the survival brain, or what we call the reptilian brain, brainstem, pons, and medulla. So the craniosacral work tends to have a phenomenal ability to turn sympathetic firing potential. And when you do that, the parasympathetic kicks on almost immediately. And the parasympathetic system is divided into 2 parts. So we talked about, when we look at the vagus nerve and the vagal response, you have the ventral vagal system, which controls all the major organ systems. It's health and vitality, rest and digest. Whereas the dorsal vagal system is the freeze part. So what the craniosacral work will do is it'll tend to turn down the sympathetic system, turn down the freeze response, and allow the ventral vagal system to kick back on for health and vitality. To me, that's the essence of what we do. And it really helps to diffuse the emotional impact of the trauma event. So as Dr. Upledger was saying in the 70s, and obviously Bessel van der Kolk, his book, The Body Keeps the Score, talks the same story, and that the body doesn't get rid of anything. It stores it, it buries it. And that emotional hook is there to be activated anytime the symptom presentations are challenged again. So the benefit of cranial work, craniosacral work, it really helps diffuse that, because it really, if the trauma pattern is locked in the body, as good as talk therapy and counseling is, it doesn't release the trauma pattern locked in, which then links right away to the brainstem, the reticular activating system, by way of the sympathetic nervous system, and by there to the limbic system, which activates a response. So the body holds on to trauma, and craniosacral work is a phenomenal tool, treatment approach, that helps to diffuse that sympathetic biasing and turns down that emotional hook that's in our system. And it tends to restore a sense of self, purpose, and well-being, and generally hope. Now, in the research projects that Dr. Upledger has been involved in when he was doing them, they did 2 major ones with veterans. One was here at the Upledger Institute, one was in California. And the one in California, done in the 90s, was mainly dealing with active duty personnel who were back to the United States for leave and recovery. And they would all, in that pilot study, they all got craniosacral work. And then basically they would redeploy back into the war zone. And then when they would come back, they'd be interviewed. and they want to know what was the benefit of the craniosacral work. And basically, to a person, they almost said that it helped give them a sense of hope again, and it let them go back into the arena that they're trained for and know that they had help on the other side. So it really gave people a sense of purpose and will. And the fact that they could go back into very difficult situations because they knew there was hope. So thank you. So if we take a look at this stress response, just simple, this is a standard stress response that you'll find in any medical physiology textbook. So you're walking down the street and you hear something, maybe it's nighttime or it's dusk and you're in an area of the town you're not familiar with, and you hear noises around you, and you get nervous about that. So out of that environment, a threat leads to fear. Now here's the trigger. Fear leads to a thought. So that thought goes from the frontal lobe probably to the hypothalamus. That hypothalamus sends a message or a thought, which is a collective protein links, into the pituitary. The pituitary then fires up the adrenal glands by increasing the production of adrenaline and cortisol. These are your sympathetic activators, so to speak. So it increases the sympathetic autonomic nervous system activity, and it takes the body instantaneously protection and action. So in doing that, blood supply is increased to the skeletal muscle, increased to the heart and lungs, because you either have to fight, flee, or possibly freeze. And it also increased blood the hindbrain, which is the reptilian brain or survival brain, the brainstem, pons, and medulla, because that's all action. There's no thinking there. Just think of the reptiles we see running around. If you're in Florida, I'm not sure where all of you are, but if you are in Florida or the Southwest, you see these little anoles or geckos all over the place. And, they're not thinking about stuff. They're either moving to something or moving away, right? So at the same time, the parasympathetic system, the PANS, parasympathetic autonomic nervous system, is turned down because the body can't do both at the same time under a stressful, threatful environment. In a normal everyday event, yes, they can, but the proportion is shifted heavily to the sympathetic biasing under a stress response. PTSD is what we're talking about. And that'll tend to decrease the growth. Cells and body organs don't need to grow. They need to function. Decrease blood supply to organs, decrease immune system function. All the energy is funneled into the parasympathetic or the sympathetic nervous system. Over time, that leads to disease. That decrease in blood flow to the forebrain going to the hindbrain decreases the ability to think. Decreased mental clarity, brain fog. Do we know people like this? I'm sure you see them every day. I do. Leads to confusion, and over time, decrease in IQ. Next, thank you. Now, this is a very interesting little circle. I think everyone has seen this somewhere in your lifetime. It's been around for 2,000 to 3,000 years, and every book, every spiritual book, every religious book, every New Age book that talks about the law of attraction, all that kind of stuff, says the same thing. You have a thought, and if you repeat the thought times, you get an action. If you repeat the action enough times, you get habits. And if you repeat the habit enough times, it becomes a belief system. So this is the cycle that is at the forefront of creating the problems in anyone with a trauma event, especially in PTSD. And this is the essence of Bruce Lipton's research. I don't know if most of you, I'm sure, are familiar with Bruce Lipton, author of The Biology of Belief, a strong proponent and probably the major mover and shaker in this whole area of interest, which is called epigenetics, which means epi means above the gene. So basically what Bruce Lipton's research has shown, as well as others, that genes are turned on or turned off by their perception of their environment. He's kind of gone against the grain of the dogma of genetic determinism, which used to say, or still a lot of people still say, the genes determine who you are. You're kind of cast in stone. But from Bruce Lipton's research, as well as others, you're not the victim of your genetics, you're the victim of your perception of your reality. So as you see the world, so you manifest it. And this is the essence of a lot of the books that came out under the guise of the attractor factor, the law of attraction, The Secret, all these books that came out in the early 2000s. So if we take this to the next slide, and this is that same flow sheet that we talked about once before. You have a threat. So the red represents parasympathetic response. The green is parasympathetic. So this is exactly the same as that nice, clean cut, typed up flow chart. Right? What makes it different is that upper left-hand corner, you look at this thought, action, habit, belief. And then you see the connecting word perception. So when the thought is so intense, it leads to an action, repeat actions over time, creates the habit of response, which then creates a belief system. Now, all the thoughts coming out of that belief system are under the perception that the world is a dangerous place. And so fear is the driver. So now our individual with PTSD who had maybe one serious event, or maybe he had a series of serious events, the perception is now tinted by the lenses of fear. So you're now seeing the world through eyes of fear. So this is the system that's driving almost all of our patients. And I think post-COVID, as people are coming out of the woodwork, we're finding this more and more the case. So if you can show the next slide, Donnell, that would be good. So just thinking that slide, and I mentioned once before, what does craniosacral therapy do better than anything else that I have ever uncovered or discovered? I'm sure other disciplines will say the same thing, but craniosacral to me has the ability to turn down that sympathetic firing potential, the excessive firing, because light touch is not perceived as threatening. And the touch we use is about a 5-gram touch. So there's no defense for that. That 5 grams of touch goes right to the limbic system. The limbic system sends a message to the sympathetic nervous system to turn down. We don't need to fight, flight, or freeze. We can just roll with the punches a little bit. And what that does is lets the parasympathetic kick back on, and now you have started the healing journey. So that handles that flow chart. But what it doesn't always handle is that little circle, the thought, action, habit, belief circle. This is where the SomatoEmotional Release, or SER, comes in handy. So if you're not familiar with this concept, it's simply a SER, SomatoEmotional Release, is a therapeutic process designed to help the body dissipate the residual effects of past injuries or negative experiences. The body tends to hold on to negative trauma patterns. Yes, we remember good ones, but it doesn't have the same physical impact on our body, our cells, our tissues that a negative trauma pattern will carry with it. The whole process was discovered by accident by Dr. Upledger and Dr. Carney in a research project when treating patients and watching them respond and watching the emotional response that came out, especially with working with children. And so on the next slide, we can see that how this basically works. So it's a process that occurs when the inner wisdom, inner physician, whatever you want to call that, intuitive nature, higher self, feels safe and knows it's time to release the trauma. The body doesn't do anything. It compensates it and buries it until it's reignited. It's kind of like a splinter that gets buried in the tissue. eventually it has to come out. It requires sensitivity on the part of the therapist, as well as the ability to hold a sacred space for a patient. There has to be an ultimate trust to be that vulnerable, which is what it requires. And it often requires the exploration of that belief system that created it and to hold on to it, even though the patient, us, the client, doesn't remember it because it is in a non-memory, non-conscious condition until we touch it. And then it comes out with abandon. And the next slide just kind of shows you a wrap up of this. And it's based on the concept that the whole body, including cells, tissue, organ systems, have independent but integrated consciousness. Dr. Upledger was saying this in the 70s. Bruce Lipton is saying it today. Right? It's based on the body wisdom, utilizing the significance detector, which is just a way when the body is in a position of a significance for a trauma, the cranial rhythm stops cold. And that's usually what Dr. Upledger would call the significance detector. That's when whatever the patient is thinking about at that moment in time is has a significant correlation to the trauma event. And it kind of guides us how we then treat. If we're treating, if we're doing dialogue work, it helps us guide the dialogue work. And on the next slide, oh, that was the last slide. So anyway, at this point, I'm pretty open. This is just contact information, which you can get later if you didn't get that. I'm open for questions. We have a few minutes to take those, and I'm always love questions. I can't guarantee the answers will be any good, but I'll give you all my best shot at it.
Okay, hi.
If you want to read them, it's fine for me.
I do. We so far, and everyone, there's still time to send comments or chats, questions for Fred. And Susan is saying, hello, I'm in Jersey Shore. Are there any signs from the client when there is SER or trauma release during session?
Great question. Thank you, Susan. Absolutely. If you're conscious, no matter what discipline you're doing, but especially in the craniosacral world, we're paying attention. We're tuning into our patients just as you're doing it. We're looking to blend and meld. So you're going to see it. If your eyes are open when you're treating, you will see it coming. You'll see the breath change. Sometimes they go into hyperventilation. Sometimes they will hold their breath. They may grab a body part, a heart, a stomach, their head, a knee or an ankle, a hip. If they're an amputee, maybe a phantom limb pain will activate. So yeah, you'll see it. You'll hear it. Sometimes you'll see the liquid memories coming out of the corner of their eye. You'll be in tune to it. Absolutely.
I haven't seen any other questions come in yet, Fred, but I was wondering about for children, birth traumas.
Oh boy.
And, how do you, I guess, yes, you would know it's a difficult birth, but how do you know it affects an infant? And when is too young to start being treated?
Well, great questions on health. Thank you. Never too young to start treating. Treating in utero is the best time. Helping the mother have a healthy, vital uterus and for embodying this baby, because the mother's biochemistry is the baby's biochemistry. If she's stressed out, she has extreme stress responses. That biochemical response is being translated right to the baby. And the baby's born kind of with sympathetic biasing. And from Dr. Upledger's perspective, it's never too early or too late to treat. So where they have access to treating all newborns, whether they have a problem or not, every birth is traumatic in some fashion, some just more traumatic. But when every newborn is treated, they have found in prospective or long-term study, they've done a few of those, not many, but a few in osteopathic hospitals. And Carol McClellan at the Upledger Institute, who runs teaches a lot of the pediatric classes, infants and newborns, neonates. Uh, these children it really enhances their vitality. There are episodes of baby visits for going to physicians with colic and gastric reflux and projectile vomiting and ear infections and immune system allergies is way down the Richter scale compared to children that don't get craniosacral work. So from the Upledger model, we'd love to see every child treated, every baby as they're delivered. And then basically, I think that would be the essence of controlling healthcare costs in decades to come if we could do that.
Very interesting. I know, I've had friends or friends' daughters that have had premature births, and there's a lot of stress and worry, and
Right.
the mother's wreck. So I can imagine the child would have the stress of that as well. We did have some.
Yeah, I was just going to say, talking to Carol McClellan with her a couple of months ago, she said that babies being born now, post-COVID generation, are having more trouble than ever. So she's very concerned about their future health and vitality because of mothers either having COVID or the injection, the vaccine, and the babies are still subject to that. So, and the immune response. So they're quite concerned down the road. So that's why they're very adamant about wanting to treat as many babies as possible.
Very interesting. Susan asked, at our massage location, we have a cranial cradle for self-help tool and as a set of hands. It also has a pad that can be used either warmed or cold. Can warming an area be more effective with pre or post use?
It certainly can. I think that the research on fascia in general is that fascia changes the elastin collagen bonding to become more pliable, not as scarred or bound down with heat and motion, which is the essence of your work and ours too. So yeah, heat can. A lot of craniosacral practitioners might use a heat mat heating mat on their table when they're working. Some don't because of EMF issues. So I think it varies, but I think heat in general is fine.
What's an EMF issue? What does that mean?
Electromagnetic frequencies,
Oh,
5G tower. Some people have acute sensitivity and actually it gives them brain trauma from EMF oversaturation. So some people seem to struggle with that with all the new 5G towers going up. It's one of those disorders that's coming out of the woodwork.
My goodness. Stephanie asks, how much do you explain to your clients about what you are doing during a session, since it's kind of an inner process for them and the touch can be really light? Correct.
I think all of us, no matter what our discipline is, our job is empowerment of our clients and our patients. We are in charge. So part of my job is education. Obviously, I work at the mothership right now. So when you're at the mothership, everyone comes here expecting craniosacral therapy. That's why they come. That or visceral manipulation, or we do adults and children and peds, everything imaginable. We have counselors on site. So, but I've only been in this office for 5 years. The rest of my career, I've been at this since 1986, was in Pennsylvania, Rhode Island, Naples, Florida, where people don't always know what you do. So part of my job always is, what do they know about craniosacral therapy? So I try to give them a brief education, talk about light touch. I try to describe what I'm doing and why, and give them always permission if they don't like where my hands are to tell me. Most craniosacral therapists are always working with their clients fully dressed. So they're not, we're not dealing with the issue of exposure or intimacy. Obviously, you'd have to do that through sheets the way you work. And there are we have a lot of massage therapists that practice craniosacral and interface it with their massage work. So it either can be a standalone like mine is, or it's an interfacing what you already do with other things. And so, there's no need to be on skin for cranial work. And, the patients comfort zone and vulnerability always has to be respected. So I'm always going to answer questions. I try to give them handouts. I try to give them information. Easy read book. Dr. Upledger has a great book called The Inner Physician in You, written for the general public. Another one, CranioSacral Therapy, Touchstones for Health, I think. Another nice book on case studies and why we do what we do. So it's all education, because it's all, for me, empowerment. I want them to know what's going on, what they should expect. And I usually tell them they have three options. They might feel nothing after a first session. If it's been stuck for 40 years, don't expect it to change in 1 hour session. Or secondly, they might be worse because we've tapped into a healing crisis and we've taken down some of the compensation barriers, and those things that they were dealing with are now on the surface again, but that should only be for about a day until it buries again. And then the other is anywhere from a little better to a lot of better. So I kind of give them options, and I always want them to tell me what they're doing. Call me if they have a problem. Education is critical.
Very good. And let's see, Joanne made a comment. Stephanie, thank you very much. I was thinking about having an intense SDR. This has been very helpful. So
Well, thank you.
that sounds like a really later. I'm going to invite Jack back in. And thank you.
You've lost your voice somehow.
Yeah, Donnell, we're having trouble hearing you.
Right. You have a voice like my 90-year-old
If you
father
just
there
give
for a
me
while.
the thumbs up, do you want me to go ahead, Donnell? Thumbs up, thumbs down? All right, everyone, I'm Jackie Halderman. I'm the Director of Marketing at the Upledger Institute. And I just wanted to thank you for your participation this evening and to let you know that in the next few days to expect an email that'll be coming from me, from the Institute, with some more information and a follow-up to what Fred spoke about. And it'll just give you some more options and contact information and links to other areas on the upledger.com website that you may find helpful. So be on the lookout. You'll be getting the email from me in the next few days as soon as I get this attendee list from Donnell. So that's all I have. Okay. And apparently Donnell has put a message in the chat that says tomorrow I'll email everyone. So I'm going to say thank you, and I'll let Donnell close it out if she can.
I'll say thank you as well for being there and letting us share our work.
All right, I'm going to take over for Donnell for a minute and just thank you and to let you know she will also be contacting you. And Donnell, I'm going to close it out. Thank you, everyone, for attending this evening.
Thank you.
Thanks, Fred.
Thanks, Jackie.
Sure. Bye-bye.
Thank you.